Welcome back to Fight Girls Fight. For those of you who are new to the platform, my name is Shamika. I am a triple negative breast cancer survivor, and I thought it would be helpful if you all heard some of my story. After a movie, I decided to turn off my lamp on my nightstand. The lamp was to my left. Instead of me reaching my left arm there to turn it off, I decided to reach across my chest with my right arm. And when I began to put, after turning it off, I felt the lump against my arm. After feeling the lump, the next morning, I was currently working in healthcare, OBGYN. I went to my nurse practitioner and told her that I felt a lump. She examined me and she herself was concerned as well. See, I had been clinical for many years prior to that, and I was taught and had taught hundreds of women how to do breast exams and how to check for lumps. Because I had fibrocystic breast, very dense breast tissue, I felt a lot of things in my breast. But I knew what it felt like. I knew what to look for. Fortunately, I knew what to look for. After the examination, my nurse practitioner set me up with a diagnostic mammogram for pain, for a lump. Unfortunately, the diagnoses that go with the diagnostic mammograms when it's outside of your time or after you've had your original routine mammogram is pain, discharge, nipple discharge, things like that. For me, I had no symptoms. I did not have any pain, no discomfort. I did not have anything, no nipple discharge, nothing. I had no idea the lump was there. My lump was not in the bottom portion of my breast where the bra could hit it. It actually was at the very top of my breast where the bra could not hit it. And the reason why I say that is because I feel like if it would have been anywhere else around the area of my bra, I could feel something or may have felt some discomfort. But because it was at the very top of my breast, I felt nothing. There was nothing. I had no idea it was there. I repeat, I had no idea that it was there. None. So I had no symptoms. Diagnostic mammogram was scheduled along with an ultrasound. For those of us who have dense breast tissue, for those of us who have fibrocystic breasts, there's always something in there, right? But mammograms have a very hard time seeing those areas. They have a very hard time. Whether I had a standard mammogram, a 3D mammogram, it still would have a hard time seeing it. Hence, if you pay attention, for those of us who have had mammograms in the past, at the very bottom of your mammogram results, it's going to state for fibrocystic or dense breasts, mammograms cannot usually see through those. Come on now. So what should be paired up with those, for those of us who are fibrocystic and dense breasts, is a ultrasound. Hopefully the medical field will catch up and they will add that on to those type of patients to automatically, routinely do an ultrasound after the mammogram. Let's get back to it. So I was scheduled and I went in for my mammogram. For those of us who have never had a mammogram done before, it is a diagnostic tool used to detect breast cancer early in women. Okay, so your prep for this is to not wear lotion, deodorant, or powder. For those of us who forget, there are wipes. And for those of us who have scheduled our mammograms after, like later on in the day in the afternoon, there are wipes there for us to wipe everything off prior to having our mammogram. So you go into a room, you remove your top, you wipe any powder, deodorant, lotion off, because that can interfere with the image, and you put on a top that opens in the front. You walk into a room that has the mammogram machine. The tech there will help you. They will guide you over and help you stand in front of this machine. They'll take your left or right breast first, whichever one is first. They'll place it in between a tool on the machine that looks something like this. They'll place it, they'll ask you to hug the machine, and then they will tell you to breathe, not to breathe, hold your breath, and they will proceed to do the test. And then the same thing with the opposite breast. Once the area is confirmed with the mammogram, the next step is usually they'll sit you out in the waiting room, and I waited, thinking everything under the sun. I did. Nervous, concerned, scared. The tech came back out and she said, well, the radiologist would like to do an ultrasound. The ultrasound is going to give a cleaner look at the area, just to see a little bit clearer, and also to take measurements and to see if it looks or fits a description of something that looks abnormal to them. So they bring you into a room, and you are positioned very comfortably on a table. Whichever area they are looking at is the area that they will uncover. They will open your shirt, place a towel there, and they will take a probe. The probe is used as an instrument to be able to kind of go across whatever area they're looking at, whether it's your leg, your arm, your chest, your back, your breast, just to see if there are other things there as well. So this process can take some time because for me, it was my right breast. They looked at my entire breast with the ultrasound. They wanted to see, okay, that's the spot that we see. They confirmed the spot that the mammogram picked up, and then they began to look at your entire breast, including underneath your arm to see if they see anything else that looks similar to that area. Once that area is confirmed, they take some measurements, take a lot of pictures of it in different ways, and then they'll have you lay there once the ultrasound is completed, and they then download or upload those images, and the radiologist will read those. They usually don't let you leave. In some cases, I've been told that the person actually left and was asked to come back. In my case, because it was a diagnostic, not a routine mammogram and ultrasound, they knew that I found something, whether I was having symptoms or not. The radiologist then came in after a while and told me there's an area here that we're a little concerned about that we want to look at further and look at a little bit closer. So we're going to schedule you for a diagnostic biopsy under ultrasound that's ultrasound guided, which means that they're going to use the ultrasound machine to guide the biopsy. The biopsy that I had is called a core biopsy. It's a biopsy that is invasive, which means that they are going to go into my skin to the place that they are concerned with, and they're going to take biopsies. Prior to leaving the ultrasound room, after speaking with the radiologist, I was scheduled for the biopsy. Due to my anxiousness prior to, I requested from my nurse practitioner Valium. I wanted a little bit of Valium, 5 milligrams, just to kind of soothe me out for the biopsy. My biopsy was scheduled about close to a week after my ultrasound. During that time, of course, I was nervous. I was thinking all sorts of things. I was trying to prepare myself for the absolute worst, hoping for the best. You know, you prepare yourself for the worst, yet still you're hoping for the best. Well, that's what I was doing. I didn't let my kids know. My husband, I did inform him of what was going on, what my concern was, and what my fears were. I was extremely nervous. Never had a biopsy done before. So I began to research biopsies just to see what kind of biopsies, like what the plan was, what the prep was. So now I'm about to give you an account of my biopsy. At this point, you guys, I'm going to get a little technical with you because I want to make sure that I give all of the information of my experience in a step-by-step description, just to make it easier for the newly diagnosed who may not have had their biopsy done yet. So just bear with me. Thanks. Like I said, due to my anxiousness, I was prescribed Valium. And again, I asked for my nurse practitioner to prescribe that for me because I wanted to be as calm as possible. I didn't want to freak out. New experience, and it was a lot to take in at one time. So she prescribed it. I took it about an hour prior to my procedure. So here we go. Once in the room, the nurses, the radiologist wasn't there just yet, but the ultrasound techs were. I had 3 ultrasound techs, and they were phenomenal, to say the least. As women, we tend to have compassion on other women who are going through or possibly about to be diagnosed with something that's all women fear. They were absolutely amazing. I was asked to, of course, remove my top. They provided the same type of top I received for my mammogram, and they began to introduce themselves. Once I was dressed, they began to introduce themselves. They told me their names and kind of gave me direction on what to do. So I laid on the table. It was similar to the ultrasound that I had previously the week before. The area was, of course, uncovered. They opened the shirt. I was comfortable, relaxed, and they explained to me pretty much what was going to happen next. The next thing they did was, of course, place the probe with warm gel on my skin where they had confirmed it before. They looked around a little bit more still just to make sure that there wasn't another spot that needed to be checked. And once the area was confirmed, they placed a drape, which is called, you have fenestrated drapes and non-fenestrated drapes. One has a hole in it to kind of create a sterile field because they are about to get invasive, right? So they placed the drape over the area, which it had the hole in it, of course. So that way the radiologist could see exactly what area we were looking at, and we waited for the radiologist to come in. One of the techs held my hand. The other tech kind of rubbed my back just to comfort me, getting me ready, talking to me a little bit, just kind of getting me warmed up. For me, it was not a cold experience, thank God. It was a very sweet, nice, smooth, relaxing experience. I was afraid. I was very afraid. And I got emotional, of course. I couldn't help it. Who wouldn't? Before the radiologist even came in. So when the radiologist came in, he introduced himself. He told me exactly what we were going to do, what he was going to do. He told me my job was just to remain as calm and relaxed as possible. If I had any questions before, during, or after, definitely ask. I did ask, is this going to hurt? I did ask, am I going to be in severe pain afterwards? And he answered my questions, and I'm going to go through those with you. All right, the next step, what he did was, of course, he sterilized the area. He himself confirmed it as well. This is the spot that we're going to biopsy. He gave the o'clock, this o'clock, 12 o'clock, 2 o'clock, right? To be able to help the pathologists when they are testing the area, and also where he was going to place the marker. I'll go into detail with that with you a little bit later on. Once the area was confirmed, he sterilized the area. Then he went ahead and numbed it. He used a needle. He numbed the area. During this time, my hands were being rubbed. My back was being rubbed. They were talking to me, Shamika, how you doing? Are you okay? What are you feeling? Is everything okay? Take a deep breath. relax. They talked me through every step, and I'm so grateful to them for that. Very. After he numbed the area, he explained to me, this is what I'm going to do. He made a small incision in that area. There was a tool that he showed me, and he said, this is the biopsy tool that I'm going to use. He said, you're going to hear click, 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 click. He said, remain as still as possible. Take deep breaths and relax. He told me, I'm going to take 6 to 9 biopsies. The reason is he took 6 to 9 biopsies because they want to make sure that they're getting a good amount, depending on the size of the tumor or the lump, whichever one you want to call it, so that they can diagnose it properly and correctly. Because he told me this, I knew how important this part was. I knew to be patient, to be still, and to take as many deep breaths as possible. This is emotional for me, you guys, so just bear with me a little bit. Taking myself back to that day, it was a lot. I wanted to be as compliant as possible because I wanted all of the answers. I wanted to make sure that they diagnosed me correctly and that they did everything that they needed to do. So I'm all for it. So he took 6 to 9 biopsies that day. After everything, during it, I felt comfortable. I felt really, really comfortable, as comfortable as I could be. For me, it was a really great experience, and I'm praying the entire time through it. I didn't feel them. I just knew that he took each one of them because I heard the click, 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 and I knew he had gotten another one, right? So that's how I kind of counted my way through, kind of paced myself through the procedure. After the procedure was done, I saw all of the formalin containers. Those are the little containers that you usually may see after you get your pap smear done or anything like that. It's a little formalin container, and I saw them lined up, labeled. After he was done collecting the biopsy, he placed what's called a marker. There's different type of markers they have. They have markers that look like ribbons. They have these, and they're microscopic, you guys. We can't see them with the naked eye. We can't see them. But he placed the marker there for the other diagnostic tools after the fact, and or if my results came back benign, they knew where to look the next time they did the imaging during the keep a eagle's eyes watch on it. Or on the other hand, it becoming malignant, they knew where to look when they did the mammogram. When they did, let's say, for example, I can't get a mammogram done because I have metal in my body, the CT scan. They had a marker placed there as this is the spot that we looked at. This is the spot and the area that we have concern for. And this is the spot that needs to be watched or taken care of. Sterile steri strips were placed over the incision, and a pressure bandage was also placed there as well. It keeps the area clean and dry. Now we're talking about the steri strips and the pressure bandage. You will be told not to remove it or take a shower or a bath or get the area wet for 1 to 2 days. Then after the 1 to 2 days, whatever they tell you to do, do exactly what they tell you to do. But this is what I was told. I was told I could remove the pressure bandage, but allow the steri strips to fall off on their own. And that's exactly what I did. Prior to leaving the facility, my results were scheduled. And what that means is usually they'll schedule your results where you can come back, you can sit down with someone, and they give you your results. I scheduled my results. However, I did let my nurse practitioner know, again, I worked with her, that I wanted her to give me my results. I wanted my results to be more personable. And you definitely can choose to do that. You can choose to have your doctor, whoever referred you. Whoever referred means sent you to, scheduled your diagnostic mammogram and ultrasound. You can choose to have them give you your results because you know them, they know you as a patient, and hopefully you have a good relationship or a good rapport with them. So I decided that my nurse practitioner, my favorite nurse practitioner, would be the one to give me my results. And that was the best decision that I made for me. In life, we try our best to prepare. We try our best to plan. You know, we are taught and we are shown to plan life. You know, when I'm this age, I'm going to do this. And when I'm this age, I'm going to do that. And when I get married, I'm going to have kids, or I'm not going to have kids. I'm going to work here. This is my career. Everything in life we plan. This was not planned. I was completely and utterly blindsided, as all of us were. Completely blindsided. I was not preparing for this. This is not something that I thought would ever happen to me. I've seen it happen to family members and friends, but I never thought that this would happen to me. I was totally unprepared. Totally. So I had to pull myself together and get my mind right regarding the what ifs. For me, I'm a type A personality. Everything has to be perfect and lined up accordingly. I couldn't. The only thing that I could think of is the if or if not decisions. I was scared and it was completely out of my control. And I didn't know what to do. At that moment, I decided that I was going to invite God in. I invited him into this journey, regardless of what my results were going to be. Whether my results were going to be that they were malignant and I had cancer, or my results were going to be benign, but they had to watch it. Either way, I needed him there. I could not do this on my own. I did not want to try to do this on my own because I had no idea what I was doing, or where to go, or who to talk to, or who not to talk to. And people give some weird advice during this time. We're going to talk about that later. I decided that God had to be in control, and I could not do this in my own strength or on my own. I needed him. I needed him real bad. I needed him to walk me through it. I needed him to guide me through it. I needed him to help me through it. I couldn't do it on my own. There's no way I could have done this on my own. And at that moment, that's when I realized, Shamika, you're not in control of anything. You're not in control. This is not something that you could do. And at times when I didn't have the strength, I needed him to carry me. So that's what I relied on. And that's what I did. Praise God. The results. After 2 or 3 days of trying to distract myself and wrestling with everything, trying to ignore what was going on, I decided to just trust God, right? So this is what we're going to do. The day came and I was waiting for those results to come in. And I remember sitting at work and trying not to be nervous, but I was a ball of nerves. I literally could not think clearly. And then my nurse practitioner walked in. When my nurse practitioner walked in, she looked at me and I was trying to read her face to prepare myself for what she was going to say. She walked in and She shut the door behind her and she said, I got your results back. I said, I couldn't even speak. You guys, I couldn't speak. I just nodded, still trying to read her face. And when she finally said, it's malignant, it felt like a balloon had popped. Like all the tension that was built up in me for the past few days was released all at one time. I was so relieved to hear the results. But at the same time, I burst out crying. I burst out crying and my head hit my desk and I'm crying because I just was given the word that scares everyone. My nurse practitioner ran over to me and she just grabbed me and she just held me, and I cried and I cried and I cried and I cried and I cried. The whole entire time that I was waiting for these results, the first step of these results, I didn't cry. Not like this. Tears would come, but this was what we call the ugly cry. I cried. I mean, I wept. I mean, sounds were coming out of me, that I didn't expect. I literally broke all the way down at that moment. And then the thoughts start coming in. I have cancer? How long have I had this? Where did it come from? Is it something that I did? Did I eat wrong? Did I take medication wrong? All the questions. How long has it been there? Where did this come from? Everything came in at one time, and I literally was just like done. I was done. I felt as if I was handed a death sentence. Here you go. It's it. You're done. It's over. That's how I felt. I felt like there was an end to what I would call my life. I didn't think that there was any hope. I didn't think that there was any help. All I knew was I'm a mother. I have children. I have a husband. Am I ready to leave? God, what is going on? What did I do wrong? Where did this come from? What are my kids gonna think? How am I tell my kids? Am I gonna tell my kids? These are all the thoughts that enter my mind. What is my husband gonna do without me? What is my family gonna do? What do I do? What do I do? I was completely lost. I didn't know what to do. I didn't know how I was going to tell my family, my children. At the time, I had an elementary school kid. At the time, I had a daughter that was in high school, flourishing. I had 2 adult sons, one in the military, one had just came back from the military. I was a grandmother. Then you think about your job, and then you think about school. You just think about your life as a whole. And I was just going through a lot. It was a lot. And I just was, everything stopped. Everything stopped. Now, here comes the part where confusion began because the process started fast. Now, mind you, I don't know my staging. I don't know what kind it is. I didn't even know there was more than one different kind. I didn't know it was different kinds. I thought cancer was cancer. Breast cancer was breast cancer. I thought, I only had one option. Everything that the public gives you, everything that we see on movies is what I thought, right? All of that. I had to figure out everything and go through these things. I had to motivate and encourage myself. If I was going to get through this with God, I had to do that. So here we go. After I was given the first step of my diagnosis is when I was scheduled. My nurse practitioner at that moment scheduled me for my MRI, my oncology appointment, general surgery appointment as well. Let's begin.